All right. So today our topic is about COVID vaccination for children, presented by Dr. Farhadi. A short bio about Dr. Farhadi. She is a doctor from Iran. She graduated from Shiraz Medical University as a pediatric doctor, a doctor for children. And then she moved to Canada in 2001, where also she did residency here at Queen's University and at the University of Ottawa. She started her practice in 2011 as a consultant in pediatric, and she works with newborn kids or neonates. Dr. Farhadi now is currently working at the Ottawa Hospital, and she is having her own practice. Before I leave the floor to Dr. Farhadi, I just want to tell you that there is no relationship with any financial sponsors for this presentation. The session, we did not receive, or Dr. Farhadi did not receive any money or financial support from any organization, nor Pfizer or any other institution. And this session has not received any kind of support from any other organization. Okay, we will start with a short presentation, and then we start receiving your questions. I can see already a question in the comment box. So yes, go ahead, put on your question. We will ask them to Dr. Farhadi. And if by any chance you have any question during the session, just let us know. We will give you the floor to speak. Okay, Dr. Farhadi, it's yours.
Hi, everyone. I'm so happy that I got invited to have a little bit chat with you guys and give you some information about the immunization and vaccination. So our talk gonna be mostly focusing on vaccination for COVID, although I start with a little bit of the talking about what's the vaccine and what the vaccine is doing for us, and we go from there. And I would be happy if you guys have any question to let us know and be able to help you to understand the situation, and if you have any question, to answer your question. All right, let's just start about the first, just the basic thing. What's vaccination? Technically, you may heard vaccination, immunization. It's something that it's helping you to be protected, not to get sick when you face an infection or germ or bacteria. How the vaccination how we get the vaccine. So it could be in different way. Either it could be by like a little bit needle or shot, or can be given by mouth, or can be kind of spray in the nose. Sometimes some vaccines are only one dose, and sometimes vaccine needs to be given more than one dose, maybe 2 or 3. And sometimes they need to be repeated each year, like a flu vaccine. So now, COVID vaccine. How is the COVID vaccine? COVID vaccine is technically a shot or needle, and it's slightly may hurt you like a little bit. I call it always mosquito bite, but it's technically helping that to protect you not to get infection. For now, we know that at least we need 2 doses, which has to be 3 weeks apart, and the most protection gonna be made by after the second dose. How long it's gonna protect us? We don't know yet. Nobody knows yet. But at least we know it's going to protect us at least for a year, and we're going to find out later. So how that works, how vaccine works. So when we get sick, technically, it means that a germ or bacteria or virus enter our body and make us sick. So when something's foreign, like a bacteria or virus enter our body recognizes it as a foreign, as an enemy. Therefore, our body needs to come and destroy and protect us. In order to do that, our body has to make some things to fight with this enemy or foreign things, which we call it antibody. So our antibodies technically are recognized are the germs, bacteria, virus as the invader, and they're going to attach to them and try to fight and destroy them. When antibodies are strong enough, then they're going to kill the bacteria, and then we're going to be protected. So that's technically the job for the vaccine. Vaccine is going to produce some of those antibody already before we get infection in our system. So whenever we get faced with that infection, antibody is there, and then it's gonna come and quickly destroy the infection, destroy the bug, destroy the germ, and we don't get sick. What are the vaccine? Either they are a piece of the virus or germ, or they are dead virus or germ, or they are weakened, like they are not active. The only thing that they can do, they can technically go into our immune system and stimulate and produce antibody to protect us. The antibody is technically our soldier. So when we have that vaccine, when we have those antibody or soldier, then we are protected. And if we're faced with the actual germ, we don't get sick. Now, let's talk about the coronavirus. How they made this vaccine. Is it from dead virus? Is it from weakened virus? No, it's technically they made a vaccine from piece of the, if you consider virus as like a body, at the out of the body there is some things like a small feet that we call a spike. So that spike has some genetic information. They made that vaccine similar to those spike, technically the same genetic information, but it's synthetic. It's not from a virus, but it's very similar and has same genetic information. So they get it, they inject it or shot it to us, and when it goes to our body, it's just a spike. So it goes to it's just the genetic information. It goes to our cell, it produces more and more spike. Same thing that when we get infection, so the antibody started to say, oh, wait a minute, you are not from me, so let me make some soldiers. So antibody gonna be produced, and they are coming and attached to those spike, and they're gonna kill them. After they killing those spike in our system, then the antibodies are there. So if the actual coronavirus comes to our system, then they recognize it and say, oh, wow, we know you. And then they're coming, attack, and kill that virus.
Okay, doctor, maybe after this slide, we can start answering a couple of questions, for example, related to the effectiveness of the vaccine. So maybe you present the slide, and then I can read some of the questions that that are already in the chat.
Yeah, sure. So always there's a question, is COVID vaccine effective? Two big associations. One is the association is usually for infection disease. We call it CDC. They approved based on the study that they did on especially young people, it's 100% effective to prevent severe infection. And the other association, which is for safety of the food and drugs, they approved it is 95, more than 95% effective to prevent severe infection. All right, now I'm gonna wait to see if you guys have any questions so far.
There is many questions. So I will start from top to bottom, but like maybe we can take all of these questions now. We can leave some till the end. I have Dria asking, can you guarantee these vaccines are safe for use in children?
That's a really good question. There has been, they started searching this or investigating the safety of this vaccine on kids between 12 to 19 years old. They did this investigation on more than 2,000 kids at that age. And technically, they divided these groups to two people. So 1,100 of them got vaccine and 1,100 of them got only like just the water, and they didn't know they have water. Nobody knows that they had vaccine or water. After investigating, after checking on them, the group that did receive the vaccine, none of them get COVID. The group did only got sugar water, and they didn't know that they got sugar water. They still got they still got infection. So in that study showed that vaccine is very effective to make them to protect them. But we're gonna talk about that a little bit on a further slide. But generally, based on that research, it is very effective. Having said that, new research are started to doing a vaccine on the kids between 5 to 12. So we're gonna soon have more information how the vaccine is effective or safe even in the younger kids.
I have a question from Sarah. Can you guarantee there are no side bad reactions or side effects to the individuals?
So Sarah, definitely we'll talk about side effect. Nobody can guarantee that no one gets the side effect, but definitely I would be happy to navigate through side effects, which are two groups, mild side effect and major side effect. We're gonna talk about that, and definitely, hopefully I can answer your question on the next slides.
Okay, I'll just ask you one more question because we move on and then we leave the rest till the end. Aren't children more susceptible to vaccine injuries and adverse reaction than they are if they contracted COVID-19? It's also from Dria.
No, they are not more prone to side effect of the vaccine. You are right. The good news that kids are far less, I would say, prone to get severe infection, which is the good news. But in the same time, vaccine is not making them sick more than adult. So it's almost the same.
Okay, we will move on and then we continue with the rest of the questions after, okay?
All right, so technically the vaccine that has been approved for the kids at the moment is Pfizer. Moderna is doing research but hasn't been released. So at the moment, we're only talking about the efficacy or vaccine COVID for the kids. It's going to be only about Pfizer. So who should not get the Pfizer vaccine generally? The person who has had reaction on the first dose, or a person who already have a history of reaction to ingredient of the vaccine, or a person currently having sign or symptoms of COVID infection. They cannot have the vaccine at the moment, but they can have vaccine after their infection or sign or symptoms gone and make sure that it's not COVID. So what are the ingredients of a Pfizer BioNTech vaccine? Is technically there is two parts, medical part and non-medical part. Medical part, I mentioned, this is a genetic information of a spike, which is messenger RNA. And non-medical part is lipid or fat, salt, and sugar. So if someone has any reaction to any of those ingredients, should avoid getting vaccine. So I hope that the next two slides gonna answer some of your question about side effect. As I mentioned, we have two groups of the side effect. The most, I would say, common or minor side effect, such as pain at the site of injection. We may feel a little bit tired. We may get a little bit headache, a little bit body ache or muscle pain, feeling a little bit nausea or even a little bit loose stool, kind of a little bit feeling of the lump or bump in our neck or armpit, feeling of our joints are painful and sore, mild fever and chills. These side effects usually last by 1 to 3 days. If it does bother you, what you can do, you can just contact your physician, or at the center gave you vaccine and you can take Tylenol or Advil. But one of my suggestions is please do not take Advil or Tylenol as prevention or before vaccine, because we don't want anything interfere with the effect of the vaccine. So as I mentioned about the minor side effect, which is common and it could be happen in both adult and kids, there are more severe side effects, such as hives or rashes all over the body, difficulty breathing, like a hard time to breathe. The face might be kind of get puffy or feeling sore throat or feeling drowsy, very high fever, which is more than 40 degrees centigrade, or feeling of the heart beatings and fast heart beatings, heart pounding, seizure or convulsion, or a feeling of the little bit of the numbness or odd feeling on our sensory. In that situation, you have to do two things. Either immediately call 911 or going to the nearest emergency hospital. So you are not doing anything at home, you need to go to a medical center. After the acute situation or emergency situation is resolved, then it needs to be technically reported. Where we can report, it's going to be your parents' job to report to either FDA, which is Food Drug Safety Association, or Infectious Disease Association, which is CDC, or directly to Pfizer. So there are lots of the information where you can report, but I put some of them here. There is also like an app for the smartphone, call it VSafe. It's technically been designed by CDC, and it's technically trying to monitor safety of the vaccine. So based on some question, they want to make sure that everybody stay safe after vaccination.
So I'll stop a little bit here, doctor, and take a few more questions.
Sure.
Also from Sarah, let let alone can you guarantee the person getting the vaccine won't have life-altering changes and damages? I think we will cover this part at the end of the presentation.
Yeah.
I'll move on to the next one. Why would medical professionals not recommend to wait for the vaccine for children until it is at least FDA approved?
So this has not been approved by FDA, but it has been authorized for the emergency because we are in the pandemic and it is emergency situation. We try to technically we try to end this pandemic, and we'll talk about why we are suggesting or why encouraging kids to get vaccine, because technically kids are still 1/5 of the population, and in order to have the a herd immunity, which means that everybody in our community remains safe, we need to make sure we try to, as much as possible, decrease the number of the viruses between peoples or in community. But again, that question we're going to answer in the next slides.
Doctor, just to continue the question of Dria, she's asking if all clinical trials will be over by 2023. Is this true?
Sorry, I didn't get
the clinical trial that to have the FDA, the full FDA approval.
That I don't know that answer when it's going to be completely approved, but it has been authorized based on the current research and studies. It has been authorized for the emergency.
Yeah, I have here also Sarah and Ria saying, Sarah is saying it is insane how people are taking the COVID vaccine when it's not even approved. Scary world. And then Ria is saying she is concerned and want to make sure that I have all the facts before administering this new vaccine to my children.
I completely understand, but you guys know that this vaccine has been very new, but the pandemic has technically changed our lives for more than 1.5 years. In order to get end of this pandemic, we changed the life of technically everyone. We have to do something, and the best and effective way to stop this pandemic is having vaccine to get rid of this virus. It has been safe based on the current studies, but as you mentioned, it has not approved, but it has been authorized. So based on the current study, based on the kids who still are followed, the kids who've been enrolled in that study from December 2020 until March 2021, they still get followed to make sure they don't have long-term problems. And it has been stable. They have been quite safe for kids so far.
Okay, I'll take the last question before we continue, and then I will ask the rest of the question after. From Kai, will the vaccine protect me from new variants?
Technically, so far, the vaccines, especially Pfizer and Moderna, are proved that to be effective for all the new variants so far. But we don't know in future if a new variant comes that this vaccine may not be effective. That's why we try to, as much as possible, to decrease the chance of this virus to go around and change and making a random change and making a new variant, which may not be responsive to the vaccine.
Okay. So yes, doctor, you can move on with the presentation, and I will ask the rest of questions afterward.
Okay. So it's very valid concern for you guys that true that fortunately kids and youths they are far less to develop severe infection. And among the people who was admitted in hospital, only less than 2% are youth and children. Having said that, however, the effect of the pandemic is not just the infection. There is a lot of the effect that we call it collateral effects affecting kids, and such as it affects their schooling, it affects their social life, like getting together, having time with friends, mental health, normal schooling. So therefore, we need to consider as a major impact on everyone. So why youth needs a vaccine? So technically, we told you guys that vaccine can prevent severe infection and hospitalization, right? Even the number of the kids who may less than 2%, still 2%, they don't need to get severe infection and needs to be hospitalized. Vaccine can help to prevent spreading of the coronavirus. And therefore, children and youth can resume their own usual life activities, schooling, having time with friends, birthday party, sleepover, all those activities that you guys used to that and enjoy that. Having vaccine and decreased number of the virus spreading between people, decreased risk of the mutation and new variant that may be a risk or resistance to vaccine. Generally speaking, 21% of Canadian population are between are youth and kids between 0 to 19 years old, based on the 2020 population statistic. So it's 1/5 of the people are kids, and if those number of the people gets vaccine, so it's gonna be easier to have a herd immunity. So you were asking variant, yes, since technically mutation is a result of the just random change in the genetic information. Virus is not smart, doesn't have brain. It happens randomly. The good news, most mutation is harmless and even make it the virus more weaker, but in the same time, there are some mutation that make a virus to be more wild and infection, causing infection more. The first mutation technically happened, I would say bad mutation happened in September 2020, that started from UK. And then soon after we had a more variant like a beta and gamma, and the last one, which is delta, and probably you heard about that. The delta, which is the last one, started from India. It has actually 2 mutations in the same time that make the virus to spread faster, make the virus to be more dangerous, and technically also it may increase the risk of somebody that already had infection again get infection again. How to stop mutation of the new variants? Obviously, we already answered the question, vaccination. Fortunately, the immunity that we can have from vaccine is more effective than waiting that get immunity from infection, because you never know, if you get infection, you may get really sick. So we are not going to wait to get infection to be immune. Vaccine help us to have immunity. And in other sense, vaccine is technically decrease the spreading of the virus. Therefore, less chance for the virus to change, an opportunity to produce a dangerous variant. All right, how to do to stop pandemic? Number 1, more vaccine, less spread of the virus, and less variant. the second thing, make sure that it's not just the vaccine for specific country. Make sure that every country, every places in world have access to virus in order, because if there is a variant in, for example, India, it may come to our country and again, it can spread easily. So vaccination for everyone in all over the world. And that's the only way that we can technically get over of this pandemic. As long as there is a one new type of the variant, pandemic is not over yet.
So I'm gonna ask you a couple of questions, Dr. Dria is asking if children have significant a significant resource of spread the virus, and also she's asking not everyone is at the same risk for the virus, correct? Like maybe to catch the virus. Is this correct?
We haven't figured out if there is any genetic predisposing factor in somebody that make them prone or resist them. We don't have that information yet. So everyone is susceptible to get infection. So it's not. Having said that, some people, like kids, that because of the difference that they have in their anatomy and then the way of their immune system respond to virus, they are more, I would say, not protected, but they don't show, they still get infection, they still spread the infection, but they don't get sick. So it's different. It's not like they are immune or they don't get the virus, they get virus, but they don't show they have infection, but they can pass to other people. They may spread infection to others.
I have a very important question from JME. I don't know how to pronounce it, I'm sorry. How many children have died from COVID this year?
The good news that the number, I don't have the exact number, but the number of the mortality of the kids has been very, very low. So it's very low. That's the good news. But again, it's not about the mortality or severe infection in kids. It's about having back to normal life and help the pandemic to be over, to go back to the normal life.
Because it's
so kids actually, let me just tell you, kids did not get affected from severe infection. They did not get affected from dying. They got, but the number are so low. But in the same times, the life of the kids got more affected than adults, and the impact of the pandemic may stay longer in the life of the kids than adults, because the mental health in kids has longer effect, or it stays in their life and impact their future.
I have two questions about the variant. Is Pfizer effective for the new Delta variant? And what happens when more variants emerge?
So again, more variants, there is a risk of the eventually one variant may cause that the vaccine to not be effective. And again, we're gonna go back to the same spot that we were 1.5 years ago, which is not a great spot. So far, the approved vaccine by WHO, the Pfizer and Moderna, has proved they are effective to prevent dying from this Delta variant or getting severe infection from Delta variant. But still, someone may get the Delta variant infection, but it shows as a mild cold.
I'll take two more questions. There is a lot of questions, Doctor. I'm so sorry. We're interrupting you. I think there was 6 children in all of Canada that passes that passed with COVID, and they're saying also that influenza sadly kills and hospitalizes more kids every year.
That is true because these two viruses are affecting people in a different way. COVID is not causing severe infection comparing to adults because the lung of the kids are different. The enzyme in the system for COVID, in order to cause infection, is not much as in adult. Therefore, when the infection, the virus goes to their body, because those enzyme is not there, it cannot go and proliferate or make more virus in the system. But it's not the case for a flu vaccine. So true that the number of the kids died from COVID is less, but influenza killing more kids. Therefore, every year we advocate, we encourage all the kids, and not only kids, everyone, to get the flu vaccine in order to protect kids. True that kids dying more, especially young one, dying more from the flu vaccine, flu infection. But by end of the day, we encourage kids to get both flu vaccine every year, adults to get the flu vaccine in order to protect their kids. In the same times, we advocate for the COVID vaccine in order to protect more people and community.
Okay, doctor, I think we still have a few slides. You can go ahead, and then we continue with the rest of questions with the remaining time.
Sure. So there are some myths which is not the true and they are not the fact. So one of the question is, does COVID affect my DNA? Technically, the answer is no, because that genetic information or messenger RNA is coming into the cell but cannot go to the nucleus, which the place that DNA is located. So they don't have any access to DNA, which is inside of the nucleus. So the answer is no, it cannot. This one of the concern is, does COVID vaccine affect my ability to have kids in the future? No, messenger RNA is not affecting fertility, does not affect menstruation or having kids. One of the concern was, does the vaccine implement a microchip in my body to control me? No, messenger RNA does not contain any chip. The next myth is, can I get the infection from the vaccine? No, you can't, because it's not the virus. It's a synthetic protein similar to the same genetic information. So it cannot cause any actual infection. So one of the other things is, can COVID vaccine affect the heart? So yes, there are some reported cases of having heart problem that we call it myocarditis and pericarditis, especially after the second dose, and mostly happens on a boys older than 16 years old. What is myocarditis? What is pericarditis? Myocarditis is inflammation of the heart muscle, and pericarditis inflammation of a layer that the cover heart. Having said that, is actually a study showed the heart problem, myocarditis and pericarditis, can happen with the COVID infection more than COVID vaccine. So still, no matter what, still CDC is investigating to see the relationship between vaccination and heart problem. Most cases, fortunately, have been very mild. They responded quickly. They recovered after a few days of the rest and taking some medicine. What are the signs or symptoms that make us suspicious to have heart problem? number one, chest pain. Number two, having difficulty breathing or shortness of breath. Number three, having heart racing or kind of heart pounding.
Okay, so we have lots of questions. I'll try to cover as much as possible. I have, why is it that I've heard that it doesn't prevent the spread of the COVID? Is that true?
No, it is. Okay, so when a person gets virus, that the number of the people gets virus from that person, it's kind of it's not even double. It's maybe like a by 16. 8 to 16 people are prone to get virus from one person. Now imagine if we try to decrease the infection and one person doesn't get infected, 8 to 16 people are going to be safe. And gradually, because it doesn't happen in one time, it has to be like the whole community to get the vaccine and protected in order to other people to be immune.
If I don't get my COVID vaccine, I like this question. Why will I kill my grandma?
Oh my God, that's a really good question, but I don't like to say there is a risk to kill, but there is a risk that you may carry on and passing to your grandma or to other loved one.
Okay, what kind of vitamins should I take to help my immune system?
Okay, so it's different from what type of the vitamin may protect us from COVID, because some people think there are some vitamins helping, but generally speaking, vitamin C and vitamin D helping to protect or boost immune system for everything, not specifically for COVID.
Okay, let me see. Just a second, I lost the track. Okay, isn't herd immunity achieved at 60-70% of the or the population? Why are we pushing for 90 and more?
Herd immunity is technically going to be produced by immunization more than 75%. If we already have kids composed of the 21%, means then we don't have that much room for the people who refuse, because no matter what, some people are against vaccine. Even the vaccine for years and years and years have been used and proved and passed the test of the time and proved to be very effective. Still, some parents avoid of having those vaccines for their kids. So we still have those number of the people. And on top of that, if we have 21% of the kids to avoid of the giving them vaccine, obviously then we got a hard time to achieve herd immunity.
There is a question that I did not understand. I will just skip it and okay, so there are questions that are not related to children. I will not ask them. Will the variants ever end? Will we ever be able to get back to normal life without masks and distancing? This seems like a never-ending loop, even with a huge amount of vaccinations.
That's the aim of vaccination. That's the aim of the herd immunity, to bring the life back to the normal. To bring the life back to the normal way and avoid of to be able to stop social distancing, to be able to go places without mask, to have a normal life, normal social life. And that's why we are trying to achieve that herd immunity. And it's not going to achieve as long as we don't have the herd immunity. And that variant, unfortunately, we told you, even you guys are asking why pushing the kids to get the vaccine, because if kids still carrying the virus, sorry, I'm on call. If the virus still can spread between kids, there is a chance for the new variant that even those 75% people who got vaccine and immunized, they are not immune anymore. And we don't know yet, maybe after 2 vaccination, same as flu, we may need every year to boost our immunity with a yearly vaccine in order to avoid of the new variants happening. And this is the same thing that it's not only happening to COVID, even for flu vaccine. Probably you have heard that every 3-4 years, a mutation or new variant of flu is not, the vaccine that you are getting is not as much as effective that the last year. So it's not something new in medicine. It's not something new for COVID. It's technically a normal nature of the virus that randomly changing.
Okay, doctor, there is one question that is not within the chat, but since you mentioned that, will we be taking like the 2 shots every year, or it will be like the influenza vaccine, 1 shot per year? It was asked by I received it by email.
Very, very good question, but at the moment we are standing, we don't know yet. High likelihood it's going to be one vaccine a year, but we don't know yet. It's something that again needs investigation, needs approval, and more research, obviously.
Okay. My cousin had a vaccine reaction. What is the possibility of this happening to me?
It's almost the same as normal population, because your cousin had reaction doesn't mean that you are at the risk, unless you guys have the similar sensitivity to something, like both of you guys are sensitive to same type of the glucose or lipid in your system. Like even for the brother sister, if one had a reaction doesn't mean that the other one get reaction.
So if someone had myocarditis or pericarditis, it's not necessary that if we're cousin or related, it doesn't mean that we will be having it.
We don't know yet, because we don't know how much it's related to vaccine and what are the risk of the people who get myocarditis. If we know the risk, then we can say, oh, so you have the same genetic pattern, so you might be at the risk of having myocarditis. Okay. But the good news, the myocarditis from vaccine has been very mild, and it was resolved within a few days.
Okay. At what point we can accept some level of infection or sickness in the society, like we have lived for so long with influenza illness and death?
Well, that there is no specific, like, okay, this is the number. Obviously, we don't have any specific number. We say, okay, this is our tolerance of this number of the people. If they die in a year, we are not concerned. It's hard to define our threshold or the boundary for having vaccine or not based on the number of mortality. The only things that we know, as long as there is a fast spreading, people who get sick and need to go to hospital, the normal life has been stopped. The whole community has been affected. So this is the time that we need to have some action.
Okay, I'm gonna skip few statements and few questions because we addressed this before. I have a question. Can you explain this idea of asymptomatic spread that you spoke about? We have always been taught in the past that if you don't have symptoms, you can't make others sick around you. Why this virus is so virulent that even breathing in someone's direction is a threat? This is a good question.
So if someone said, if you don't have symptoms, but you have virus in your system, which is technically case of the kids, you don't spread the infection, it's not true. Because there are lots of the reports that parents got infection, grandparents got infection, teacher got infection from the kids who don't have symptoms. Or one kid had no symptoms and then checked because parent had symptoms, and then the other classmate been checked and some of them was positive without having symptoms. So if somebody doesn't have symptoms, still can spread the infection. You ask why this virus is so virulent. That's unfortunately the nature of this virus. But the good news is the kid's body working in a way, their immune system, their anatomy, their lung, their hormones in the system is in a way to make it in favor of them to not get sick comparing to adults.
Do I have to get it? Will it be dangerous without it? Do these vaccines have animals in them or aborted fetuses?
There are few case reports of having abortion when mom was having infection. However, not much. There is a lots of the pregnant women who got infected. And the good news, they did not pass to their babies before delivery, but there is risk after delivery, they pass to their babies. But the moms who are pregnant and get COVID because of the pregnancy affecting immune system, they technically change their category from normal adult to susceptible or immune compromised adult.
Okay, I have great questions here. Can my parents make me get the vaccine? What if they threaten to throw me out? Can I die from myocarditis? This is JME asking. And when I have to stop monitoring myself for reactions? She's asking great questions.
Okay, so your question is a lot, but I'll tell you, I'm pretty sure nobody is throwing it out of the house because that's actually a really good question, because it came to a lot of attention of a lot of physicians that kids, if they don't want to have vaccine, it is the job of parents, it is the job of doctor to go through their, ask them why specifically, what are your, what you're scared of, and try to help them if it is based on the myth, not the fact, to make it clear and explain to them to make it easier for them to understand, which technically it's not dangerous as the way that they are thinking. If you are dying from myocarditis, sweetheart, we don't have any report of the dying from myocarditis due to vaccine yet.
Doctor, is it the vaccine will protect others or it will protect us?
It protects the first person, but when you get protected, you don't get infection, you don't spread the infection to others. Gradually, technically, by end of the day, it protects both you and others.
Okay. I think I don't know anyone who had a COVID in 16 months. How is that possible when this is a pandemic? You're lucky.
Well, because of the isolation, probably you were not
And there is
seeing a lot of the people. And that's the good news, that I'm glad that you didn't see people. But if you just checking the news, you're going to find out the number of the people actually died from this virus. And then you may feel, okay, so now I understand what is pandemic.
Yeah, JME, you said that how are your question not related to children? If you feel that I missed something important, please type it in the comment. Maybe I did not meant, I don't know, like I was trying to answer all the questions. If I missed something that you feel it's important, go ahead and write it down again. I apologize with that. We did not need to wear masks and distancing to prevent people from catching influenza. Why not? That is killing many people every year in Canada, mostly same demographic as COVID. Do you want to add any comment to this, doctor? Like why we're not, because there is, you know, during flu season, why we're not wearing masks while the influenza, people who get influenza are with the same demographic as COVID, and influenza is more dangerous than COVID.
Influenza is more dangerous on kids than adults. And the number of the mortality is not as much as influenza. Like yes, in 1920 killed 1 million people at that time. And at that time, people were wearing masks. Fortunately, after that, when the vaccine started providing immunity, the number of the people dying, and that was pandemic at that time, started being less and less. Still, more kids are prone to get infection and get hurt badly from the influenza, but it's not like a pandemic that we have to everyone put the mask. As long as everyone be aware of the benefit of the vaccination, then they don't need to put the mask.
Yeah, I'll just take one statement and one comment. There is so that we mentioned about the ingredient of the vaccination, and it doesn't contain animals nor fetuses, just to clarify this point. And the question that we missed from JME was my friend Tien kissed a boy who was recently vaccinated and he got sick. Also, after hanging out with my grandma, I got bad period cramps. I've heard of this a lot. So maybe this is the question. Is it related to the COVID or to the vaccine?
So like your grandma got the vaccine and you hang up with your grandma, you got sick because of your grandma vaccine? That's the question.
Recently vaccinated. Okay, her friend kissed a boy, so she got sick from COVID.
So we already talked about side effects.
Yeah, the boy was recently vaccinated and she got sick. So maybe we need to explain to them when the vaccine will start being effective after we administer it. And then she's saying that I did not understand this part. After hanging out with grandma, I got bad period cramps. I don't know if it's related to the vaccine or to, I did not understand the question, but maybe we can cover the first part.
So the first part is, I would tell you that if when you get vaccine, you're gonna be immune 2 weeks after the shot. And then better immunity is after 2 weeks after the second shot. So in that period of the 2 weeks after vaccination, our body is still not protected. So we may get the infection. So there is a risk if we still get exposed to the people who passing the virus, we get the infection. That's true. One of the other things that I told you, the vaccine is preventing from severe infection, needing going to hospital or hospitalization or admission in ICU and dying. Its vaccine is not preventing that you get infection. You get infection, it looks like a mild cold, but it doesn't cause you to be very sick or dying from that.
Yeah. So she said that her grandma was vaccinated, and then she had bad cramps and clots from periods. So
it's very unrelated situation. So it was just random things happened with your period. It doesn't do anything with the gram of vaccination, because gram of vaccination is a protein, it's not the virus that can be passed to you. Anyone that gets vaccine does not pass anything to anyone, because it's not infection to be passed to somebody.
yeah. Okay, I'll end it here. I know that we passed the time. No problem, Kai. You're most and welcome. Doctor, do you want to tell us any final message?
Well, I hope that we can one day talk about other issues. One day that we know that this pandemic is over and we back to the normal life. And this is not gonna happen unless that we get everyone to understand the benefit of the vaccination at the moment.
Thank you so much, Doctor. Thank you for your time and effort. Thanks for everyone.
Thank you so much for having me.
It's our pleasure. And see you later. Bye-bye. Thank you.
Bye, everyone. Oh, sorry.
Yeah, I'll end it. Don't worry, Doctor.
Okay.